Hello, I'm Dr. Crawford. Today, I'm going to talk to you about asthma. We'll start with lung anatomy, then talk about what asthma does to your lungs, and finish with how to treat and control asthma. Let's begin. The airway begins with one large tube and splits into two smaller tubes called bronchi, which then split into many smaller tubes. Let's zoom in a bit. Outside of the tubes are very small muscles, which are normally relaxed and allow for nice smooth air movement. During an asthma attack, two major things happen. One, the inside of the tube becomes inflamed and swollen and gets blocked by mucus. Two, the muscles outside of these tubes tighten up. These two things make it harder for air to pass through the tube. This causes cough, wheezing, and shortness of breath. Now, let's talk about how to treat these two things. There are two main types of treatment. Both are given through inhalers that look very similar, but are very, very different. Let's talk about the first type of inhaler. When you are having an asthma attack, the medication we use is called a rescue inhaler. Some examples of these are ProAir, Proventil, and Ventolin. They work by loosening the small muscles outside the tubes. They're called rescue inhalers because they work quickly to help you breathe, but they only last a few hours. So they should only be used when you are having an asthma attack. They cannot prevent asthma attacks. So how do we prevent asthma attacks? This is where the second type of inhaler comes in. This inhaler is the most important part of your treatment, and it is called a controller medication. You might also hear doctors or nurses call these inhaled steroids. Some examples of these are Qvar, Flovent, and Pulmicort. They work by decreasing the swelling, inflammation, and mucus inside the tubes. These medications take a few days to start working, but they last a very long time. They are called controller medications because they control your asthma and prevent attacks. So, it is really, really important that you take these controller medications every day, even after your asthma attack is gone. This will prevent having to come to the hospital in the future. So now your tubes are wide open and air can pass through easily. Yay!